Hi, I'm Basma Faris, OBGYN and Certified Culinary Medicine Specialist. Welcome back to our discussion about popular weight loss diets. We talked about caloric restriction and we talked about the keto diet. Today, in contrast to the keto diet, let's talk about whole foods plant-based diet. A whole foods plant-based diet is what it sounds like. It's a diet that's made up primarily of whole grains, fruits, and vegetables, and it is absent of processed foods. Most people who follow a whole foods plant-based diet eat no or very little animal products, but we'll talk about that in a second. This is a diet that's high in fiber, that's high in antioxidants, and these are nutrients that are, known to be beneficial for our health and longevity. It's not a low carbohydrate diet, but because of the high fiber content, it does not cause people to have high levels of circulating insulin. So that may be one of the reasons why it helps people to lose weight. It can be challenging because it requires you to have access to high quality fresh fruits and vegetables, and you have to really know how to prepare them. So it's maybe hard to eat out on a whole foods plant-based diet, but again, it can be an incredibly healthy way of eating. Because there's no dairy or no meat on a whole sort of strict whole foods plant-based diet, some people may need to supplement with calcium and B12 and iron. So others will choose to, in very limited amounts, include these foods maybe once a week or a few times a month to avoid needing supplementation, and that's a personal choice. Lastly, I want to talk about intermittent fasting. Intermittent fasting is a way of eating in which people fast for different periods of time. And there are really two different ways that people do fasting. I would say the most popular method of intermittent fasting is also called time-restricted feeding. And basically what that is people will have a window of time in the day where they eat, and then outside of that window, they fast. This has been shown to be helpful in terms of weight loss, and it may just be because since people are eating in a smaller window of time, they're essentially just engaging in caloric restriction. But there is some evidence to suggest that as people fast and utilize and use up their stored glycogen levels, that also helps to decrease the amount of circulating insulin, and that may be a way that is helping them to lose weight aside from just caloric restriction. Others, instead of doing sort of this, this window in the day or time-restricted feeding, will do alternate day fasting, or maybe they'll do a prolonged fast 1 or 2 days out of the week, so where they fast for a 24-hour period and then eat normally the rest of the time. This method may not be as good for weight loss, but there is another benefit that comes from fasting, and that's something called autophagy or autophagy, depending on what part of the country you come from. And basically what that is, it's allowing our bodies to clean up cellular debris, kind of taking out the trash of our metabolic garbage, and that's been associated with longevity. So it may really not be a weight loss strategy, but there may be some other health benefits to that. But for weight loss, people tend to do well with time-restricted feeding, where they'll eat for a window of 4 to 8 hours and then fast for the remainder of the time. Oftentimes, in my experience, people may need to use a combination of different strategies. So they may do caloric restriction plus intermittent fasting, or keto plus intermittent fasting, or people may find that they actually need to change things up from time to time. So they may succeed with one method for a period of time, and then after that stops working for them, they try something else and sort of switch it up. And so I hope this was helpful. You can understand the pros and cons of the different methods and see what works for you. Thank you for listening.